11 helpful ways to stop alcohol cravings. Have you struggled with excessive alcohol consumption? Have you tried to quit drinking? How was that experience for you? In addition to possible withdrawals, alcohol cravings can severely affect your ability to remain sober. Cravings for alcohol is a real struggle for many people. Perhaps you are one of them. It is also a reason for multiple relapses. This struggle highlights the reason why recovery is often described as a journey. Relapsing on alcohol can be a frustrating experience. This frustration is especially so when you have gone to great lengths to curb this habit. Imagine going through detox and a 30-day rehab. As hard as it was staying away from family and friends, you made it work. You did this because you know how important it is to treat your excessive drinking. Perhaps you even had a 90-day treatment. Walking out of rehab, you feel confident and full of hope. You have a resolve to stay away from alcohol, and you mean it this time. After all, you have had 4 previous treatments. This intervention is your 5th, and has to be your last, you hope. You strongly believe things will be different this time, even though you are going back to the same environment. Why not? You ask yourself. This 5th treatment was different, after all. New coping mechanisms accompany you from what turned out to be an excellent treatment facility. Deep down, though, you have an uneasy feeling. You worry about a struggle you know only too well. Cravings. So, what are cravings? Alcohol cravings are the compulsions or urge to drink alcohol. The prominent symptom is the overpowering desire to consume alcohol. This psychological drive causes you to focus on getting this substance. Alcohol cravings may last for minutes or even hours. They, however, go away eventually, until the next wave. Your struggle with alcohol is worse when you are unable to manage your triggers and cravings. Relapse triggers can be places, people, things, or situations. They are what you associate with the reward of drinking alcohol. These triggers can cause intense alcohol cravings. How do you stop these alcohol cravings? There are several ways you can do this. 1. Identifying and avoiding your triggers. This step should come as no surprise. To better respond to your alcohol cravings, you need to know what your triggers are. Different people have different emotional, social, and pattern triggers. Withdrawal symptoms can also vary slightly from one person to another. 2. Mindfulness. Mindfulness is a mental state you can achieve by focusing your awareness on the present moment. It involves acknowledging and accepting your feelings, thoughts, and bodily sensations. 3. Urge surfing. This technique involves acknowledging cravings when they come on. Thus, rather than trying to push them away, you accept and ride them out. Cravings will eventually pass. They always do. 4. Distractions. Using distractions is an excellent way to overcome cravings. This technique is especially helpful when you cannot avoid the triggers. For example, listening to music, watching a movie, cleaning your house, or taking a relaxing bath. 5. Express your feelings. Even though this sounds simple, the benefits can be huge. There are several ways to do this. Some simple examples are journaling, dancing, singing, and painting. 6. Reach out to others. Calling and speaking with a friend, family member, sponsor, or therapist helps with cravings. Support groups like Alcoholics Anonymous (AA) encourage having a sponsor. Churches and other religious bodies are also good support systems. Professional counseling goes a long way in helping with alcohol cravings. 7. Get a hobby and job. An excellent way to create distractions during alcohol cravings is by engaging in hobbies and new interests. The urge to drink tends to be stronger when you are bored and lonely. Lots of free time and a lack of structure can make relapse more likely. Occupying your time with a job or hobby takes away boredom. It also gives you a sense of self and fulfillment. 8. Exercise. Regular workouts boost the release of endorphins in your brain. These chemicals are also known as feel-good hormones. Most forms of exercise help with cravings. Aerobic activities, cardio, tend to help more, however. 9. Using self-talk and recalling negative consequences. Talking yourself out of drinking is one way to deal with alcohol cravings. The adverse effects should be a constant reminder of the need to stay away from alcohol. 10. Cognitive behavioral therapy, CBT. This form of therapy helps you understand the relationship between your thoughts, emotions, and behaviors. It provides techniques to help with alcohol cravings. 11. Medication-assisted treatment, MAT. This treatment is an evidence-based approach that involves the use of medications. There is also the involvement of counseling and behavioral therapies. The most common medications for alcohol use disulfiram, antabuse, acamprosate, naltrexone tablets, and Vivitrol injections. Vivitrol contains naltrexone and is essentially a long-acting injectable form. Naltrexone, in pill or injectable form, helps with cravings. Alcohol addiction can be devastating for individuals and families. Subscribe to Addiction Blueprint for more helpful videos. Thanks for watching.